Good evening. For those of you who are just now joining us and being dialed in, my name is Reggie, and I'm with Fair Count, a nonpartisan nonprofit that focuses on increasing civic and voter participation across the South. We hope you and your families are safe and healthy during this time, and we thank you for joining us this evening for our Count Me In telephone town hall. Tonight's conversation, hosted by Fair Count, is presented in partnership with the Southern Economic Advancement Project and Kaiser Family Foundation's Greater Than COVID program, with support from the Rockefeller Foundation. Tonight, you'll have the opportunity to talk about the COVID-19 vaccine in the community with experts who can help answer your questions. Before we begin the conversation, however, we want to remind everyone that Fair Count is a nonpartisan, nonprofit organization, and as such, does not advocate for the defeat, election, or re-election of any person from any political party. We have an exciting panel of experts tonight, and this is an interactive conversation. We encourage you to ask whatever questions you may have, and you can do that by pressing 0 on your phone at any time to raise your hand. You can also press 7 at any time to connect to someone who can help schedule a vaccine, or you can find more information about where you can get vaccinated at countmeinga.org. We have a number of people who are continuing to join us, but thank you all for being able to hop on the call this evening, and we'll jump right in. Before we get to our questions, we'd like to start by introducing tonight's special guest. Ms. Kari Kviten is the South Georgia Area Manager for CORE. Ms. Kviten, would you like to say hello to our listeners tonight?
Yes, thank you, Reggie. Hello, everyone, and thank you so much for joining this discussion tonight. I'm looking forward to sharing with you and listening to any questions you may have regarding COVID vaccination. I am the South Georgia Area Manager with CORE, which is Community Organized Relief Effort, and I started working with them as we began COVID testing in Georgia, and have now continued with them as we've started with vaccinations as well. I've worked in various fields of public health and have my master's degree in public health, and I'm looking forward to all of the discussion we will have tonight. Thank you.
Well, thank you, Ms. Kviten, and thank you so much for all the incredible work that you and all the great people at CORE have done throughout the state of Georgia and in partnership with Fair Count. For those of you just joining the call, we're on a live telephone town hall conversation discussing the COVID-19 vaccine in Georgia with experts who are active in the field. We want to hear your questions and your concerns, so please press 0 to raise your hand to ask a question. You can also press 7 to get connected to folks who can get you scheduled for a vaccine. To find a vaccine near you, visit countmeinga.org or text your zip code to 438829. That's countmeinga.org or texting your zip code to 438829. Turning now to our next special guest, we have with us this evening Juwan Johnson, who serves as a county commissioner for Wilcox County here in Georgia. Commissioner Johnson, would you like to say hello to our listeners tonight?
Yes, hello, and thanks again, Reggie, for the invite. Thank you for that. And I am Juwan Johnson, one of the 5 commissioners here in Wilcox County, and I'm actually employed at the Wilcox County prison system, and I am a member of a non-profit organization called The Real Men Get Back, and I want to thank Fair Count for joining us in that a couple of years back, and we're doing real good with that. We actually have something coming up in the next 2 weeks from here. We're going to be giving away back to school bash for the kids. So once again, I want to say thank you for having me on this panel.
Thank you, Commissioner Johnson, for being able to join us not just on this panel, but joining us in different ways, partnering with Fair Count, and all the incredible work that you and the organizations that you're a part of just continue to do, certainly in Wilcox County and in South Georgia. Thank you so much for making the time to be able to join us. We're delighted to have thousands of participants with us this evening as we discuss the COVID-19 vaccine in our community. To get in line to ask a question, please press 0 on your phone. Our last special guest is Dr. Rhea Boyd, a national public health advocate and co-developer of The Conversation, Between Us, About Us. Dr. Boyd, would you like to say hello to our listeners tonight and tell them a little bit about The Conversation?
Hey, y'all. Yes, thank you, Reggie, so much for having me. Hi, everybody. My name's Rhea Boyd. I'm a pediatrician who is the co-developer of The Conversation. This is a project that's a partnership between Kaiser Family Foundation and Black Coalition Against COVID, which represents the 4 historically Black medical schools. And we have been working since before any of the COVID vaccines were even approved to develop information that's credible that our communities can trust about the COVID vaccines. So folks who are interested in more information or who have questions that we don't have time to get to today can always visit our free website, www.betweenusaboutus.org, to learn more.
Thank you, Dr. Boyd, for that information and for pretty much all of the work that you've done, certainly in developing this program and all the work that you continue to do in this area. Again, anyone can ask one of our distinguished guests a question at any time just by pressing 0 on your phone. Before we go to your live questions, we want to begin with a quick poll question. Anyone can answer by pressing a button on your phone, and we will share the results in a couple of minutes. Please wait to hear all the answer options before you press a button. Here is our first poll question. How likely are you to get a COVID vaccine? If you've already gotten a COVID vaccine, please press 1 on your phone. If you will definitely get the COVID vaccine, please press 2. If you will probably get the COVID vaccine, please press 3. If you probably will not get the COVID vaccine, please press 4. And if you definitely will not get the COVID vaccine, please press 5. We'll give everyone a few seconds to be able to press the corresponding number, but also wanted to just go over it one more time. Again, that question is, how likely are you to get a COVID vaccine? Again, those options are press 1 if you've already received the COVID vaccine, press 2 if you will definitely get the COVID vaccine, press 3 if you will probably get the COVID vaccine, press 4 if you probably won't get the COVID vaccine, and press 5 if you definitely won't get the COVID vaccine. We're going to wait just a few more seconds as people are answering right now. All right, and we want to just give a quick update. Thank you all so much for participating in this poll. We see that we have actually about 75% of people who are on this call who've already received the COVID vaccine. We have about, it looks like, another 11% who will probably get the COVID vaccine. And thank you to everyone for just participating in this poll. We wanted to, before we jump into the questions, kick it over to Ms. Kviten to just give us your thoughts. Kari, would you please let us know your thoughts about those results?
Yes, thank you. We are, very excited to hear that there has been 75% of people that have already gotten the vaccine. That is wonderful news as well. And for those that are still looking or still interested to get the vaccine, we are here today to help with those questions and to ensure that there are accessible locations and have the education or information to be able to get the vaccination. So thank you for your participation in the poll, and we look forward to continuing the conversation with you.
Thank you so much. And again, we're so glad that thousands of you have taken the time to join us tonight for this conversation about the COVID-19 vaccines. We want to hear your questions for our special guests, so please press 0 on your phone to get in line to get an answer. So we're just going to dive right into the questions. Our first question is for Ms. Kviten. First, we'd like to thank you so much again for the work that you're doing with CORE. For your question, would you please tell us a little bit more about what CORE does, and when you're out in the community, what kind of responses are you generally getting from people about the vaccine?
Yes, thank you. So CORE stands for Community Organized Relief Effort, and we are a nonprofit dedicated to saving lives and strengthening communities affected by or vulnerable to crisis. So CORE around the nation has been working on the front lines of COVID-19 pandemic for about a year now, and we've developed the operational and logistical know-how to reach marginalized and vulnerable communities. So we began nationwide with COVID testing, and we administered about over 5 million free COVID-19 tests, and now we have transitioned into vaccinations as well. So in our partnerships in Georgia, we've administered over 140,000 vaccinations so far. And, one of our goals is to ensure that there is equitable distribution of the vaccine to high risk, low income, and communities of color. So we've been working really closely with Georgia Department of Public Health, in addition to local community-based organizations, to provide mobile vaccination operations throughout the state of Georgia. Currently, we have about 25 mobile vaccination units in 15 of the 18 health districts. And in South Georgia specifically, we currently have 10 mobile vaccination units. So these units we work with local community-based organizations to partner with them to come in the communities where they offer more accessible locations for members for vaccination. And the mobile units are in different locations each day to provide that access and the ability to receive a vaccination, near your home or near your place of work or place of worship. So as we have entered multiple communities all across South Georgia, we've received a variety of responses. Some are, some have been, they just haven't had access to the vaccine and they have been eager to get it. Some want more information or want to have a more trusted partner. And so we, provide and assist with any information we are able to while we're there. And, there are vaccine hesitancy as well in addition. So we just deal with the responses in varying degrees that we receive.
Thank you. Thank you so much for that insight and for providing just more information about the incredible work that CORE has been doing, certainly around all of Georgia. We certainly thank you all so very much. For those of you just joining us tonight, welcome to this interactive conversation with community leaders about the COVID-19 vaccines and its impact on our personal and civic lives. Please press 0 if you have a question for one of our guest speakers. Our next question goes to Commissioner Johnson. Commissioner Johnson is definitely no stranger with Fair Count. In fact, sir, thank you again for making the time out of your busy schedule to join this conversation. Our question for you tonight is, what type of impact are you seeing COVID-19 have on your community down in Wilcox County and, of course, in South Georgia, particularly in terms of personal interactions and economic activity?
Hi, again, this is Juwan Johnson. Personal interaction, churches are reopening. The crowds are not large as they was before COVID, but those that are comfortable and that are coming out and worship more. My wife is actually a school teacher here in Wilcox County, and they are returning back to school on the 26th. Therefore, we know that school is open, small business are open as well in the small town of Wilcox County. And actually, my job, has got better with COVID. I work, as I said again, for the Wilcox County State Prison. And we actually had the commissioner of the GDC to come out, to come down not only to speak to the inmates, but to speak to the officer and all the employees, to let them know how important this is to get vaccines. And we have over 75% of the population of the inmates that have been vaccinated. And I'm thinking over 50% of the employees, and the numbers have been down. We not have many hospitals details as we have had in the past, and I think since January we not had anyone that was test positive for COVID. So economic, I think, is going well. And tonight I was actually scheduled to be on a Democratic Party meeting tonight, but I chose to be online with you guys. And I think the Democratic Party, they have a small crowd of those that choose to come out that are comfortable to be attending these meetings. And I think Wilcox County have picked up and have shown that we are willing to still work together and try to do what we can do to make the people believe that we are trying to move forward.
Thank you so much, Commissioner Johnson, certainly for that response and for everything that you're doing in Wilcox County. We certainly remind all of our listeners tonight that Fair Count itself is a nonpartisan, nonprofit organization, and of course does not advocate for the election, re-election, or defeat of any candidate of any party. Thank you so much, Commissioner Johnson. To our audience, if you have a question for Commissioner Johnson or any of our distinguished guests, please press 0 on your phone to raise your hand. We want to pose our next question to Dr. Boyd, who's been kind enough to be able to join us this evening for this conversation. Dr. Boyd, when it comes to COVID vaccines, what concerns do you hear most often from people who have not been vaccinated yet? Also, can you speak a little bit more to the safety of the vaccine itself?
Absolutely. So thanks again for having me. Now, over the last 6 months, I have had conversations about the COVID vaccines with people across this country, in most states in this country, to talk specifically about their concerns. And I work in a clinic, and so I talk directly to my own patients about their concerns. Some of the top concerns I hear from parents in particular are about side effects and whether the vaccines are safe, which is also the question you asked me, Reggie. And the other concern we've heard about from folks is if the side effects will keep them from being able to work or perhaps go to school or do their daily activities. So I'll spend just a second talking about the safety of the COVID vaccines. We know, not just from the clinical trials, but now from the over 150 million Americans who have gotten 2 doses of the mRNA vaccines, and the more than 300 million Americans who have gotten at least 1 dose of one of the COVID vaccines, that the COVID vaccines are incredibly safe. I want to say that again. We know from the clinical trials and from the now more than 300 million doses that have been given of the COVID vaccines that they are incredibly safe. The CDC and FDA are following really, really closely even rare serious side effects. And so maybe we can spend just 1 second on the side effects. We know that side effects are common after you receive particularly the mRNA vaccines, which are Pfizer or Moderna, and especially after your second dose. But those side effects are commonly mild and short-lived. They last about 1 to 2 days, and it's usually things like muscle aches, sometimes pain at your injection site, fevers, fatigue, headaches, and those side effects come from your own immune system working to build up that memory that's going to protect you if you're exposed to COVID. Some of the vaccines have shown more serious side effects, and I wonder if some of you guys have some questions about those serious side effects that I'd be happy to get into. But briefly, it's important that you understand that even the serious side effects we've seen are exceedingly rare. For some of the side effects, we're talking about a handful of people among millions. Odds that are better that you'd win the lottery than that you'd have a serious side effect. So the vaccines are super safe, and it's important that everybody knows that.
Thank you so much, Dr. Boyd, for certainly your answer and your insight and for just emphasizing the point about the safety of the vaccines. We're going to get to more of your live questions, but first, we want to ask another quick poll question of those who haven't gotten a vaccine shot yet. You can answer by pressing a button on your phone, but please wait to hear all the answer options first. The next poll question that we have is, what is the main reason you have not received a COVID vaccine? The options are, please press 1 if you still have concerns about the vaccine's safety or side effects. Please press 2 if you have not had time to get the vaccine. Please press 3 if you don't know where to receive the vaccine or if there's any questions about cost of the vaccine. And please press 4 if you don't think you need the vaccine or are not worried about COVID. Again, the question, our next poll question for this evening is, what is the main reason you have not gotten a COVID vaccine? Concerns about the vaccine's safety or side effects, please press 1. If you have not had time to get the vaccine, please press 2. If you don't know where to get the vaccine or have questions or concerns about the cost, please press 3. And if you don't think you need it or are not worried about COVID, please press 4. We're going to give you just a few more seconds as our answers are coming in right now. And it appears the responses that we have from our guests on the line is that about 83% of people have chose response 1, that they still have questions or concerns about the vaccine safety or side effects. That's about 83% of our respondents. Then about 17% of our respondents don't think they need it or are not worried about COVID. I'd like to be able to go back to Dr. Boyd, since you were speaking a little bit more about the safety concerns, to just get your thoughts about these poll results.
So I am actually really excited to know that the people who are on the call still have questions, because that's why we're here today. And that's honestly what we've seen from communities. There's a lot in the news about people just not wanting vaccination or being hesitant. But what we found when we actually just talk right to people, and I'm talking, I go to people's churches, we are at people's schools, we're just having conversations in people's communities. Most people have legitimate questions. And I think all of our callers here today have those questions too. So I hope you guys feel brave enough to just ask those questions to us, and we can just answer them truthfully and honestly right now.
Thank you so much, Dr. Boyd. We certainly are just as excited as you are to be able to have so many people on, and certainly to have people who have questions. Speaking of those questions, we're going to hop into our first audience question for the evening. Again, we'd like to remind everyone, as was stated earlier, that Fair Count is a nonpartisan, nonprofit organization. And again, as stated earlier, we do not advocate for the defeat, election, or re-election of any person from any political party. We'd also like to remind everyone that you can also press 7 on your phone to connect to a vaccination scheduler. Our first question comes from Miss, and forgive me if I'm pronouncing it incorrectly, Shatandra Cobb in Columbus. Ms. Cobb, would you please state your question?
That would be my daughter, but I'm her father. So I taken the Johnson & Johnson shot. Is this a safe shot that I taken?
Yes, sir. Could you please restate your question? You were talking about the Johnson & Johnson shot?
That's what I taken, the Johnson & Johnson shot. That I was wondering about, is it was a real safe shot to take? Because that's the one I took, the COVID-19 Johnson & Johnson.
Understood. Thank you so much for repeating that. I will pose that question to you, of course, Dr. Boyd, where Mr. Cobb is asking whether or not the Johnson & Johnson is a safe shot to have.
Hi, Mr. Cobb. That is an excellent question. So the Johnson & Johnson shot did show a few serious side effects that we should talk about. Most of those serious side effects occur within 1 to 2 weeks of getting your shot. So if you haven't had any serious concerning side effects within 1 to 2 weeks, you don't have to worry. You had a safe shot. But for women in particular who get the Johnson & Johnson shot, there was a very rare side effect where they saw signs of serious blood clots. So if you're a woman who's received the Johnson & Johnson shot within the last 2 weeks and you feel a pain in your muscles, in your legs or your arms, or a pain in your chest, or you have shortness of breath after you've received the shot in that close window just afterwards, it's important that you check in with your doctor. I know there are folks who got the Johnson & Johnson shot who worry that they might have had a side effect that they missed. What we want you to know is that that's not likely. If you had one of the serious blood clots from the Johnson & Johnson shot, most people's symptoms progress to the point where they go in to get checked. And so if you never had symptoms that felt severe enough that you needed to get checked and now you're doing fine, you can rest assured that your Johnson & Johnson shot is protecting you. One other thing I'd like to mention is that just this past week, the Johnson & Johnson shot also showed another rare side effect where recipients can get a specific neurologic side effect where you have a short-term paralysis called Guillain-Barré. This side effect is pretty scary because it may make it difficult to walk or do normal activities. We have seen Guillain-Barré, or that neurologic side effect, be a side effect to other vaccines in the past. So it's not a new side effect to vaccination, and it is also very rare. So if you've already received a Johnson & Johnson shot and you have not had pain or paralysis and you're more than 2 weeks out from your shot, you don't have to worry. The shot you got was safe. If those serious side effects, even though they're rare, concern you and you haven't gotten the vaccine yet, you can choose one of the mRNA shots like Pfizer or Moderna, and you don't have to worry because they don't have the same side effect profile. I hope that answers your question, Mr. Cobb, because it sounds like you probably don't have to be concerned that you got a safe shot that's protecting you.
Thank you so much, Mr. Cobb, for that question, and thank you, Dr. Boyd, for being able to provide that answer to us. You can ask your own question by pressing 0 any time. You can press 7 at any time to get connected to our folks who can get you scheduled for a vaccine. If you want to find a vaccine yourself, please visit countmeinga.org or text your zip code to 438829. Again, you can visit countmeinga.org or text your zip code to 438829. So we want to get to another question, and this question, I believe, is probably best suited for Dr. Boyd. For obvious reasons, we spend a lot of time discussing people's physical health during this pandemic. However, we don't often discuss as much people's mental health. Dr. Boyd, what do you believe are some of the key mental health concerns people are dealing with during this pandemic, and what do you believe they can do about it?
This is a great question that I'm so glad we're focusing on because you're right. Over the past year, we focused a lot on the physical health burden of COVID. But what's happened to many of us is that being out of our normal routines, kids being out of school, working from home, losing jobs, having to get a new job, being displaced from your place of, from the place that you live, not being able to go to your place of worship, all of the disruption of the last year really affected all of our mental health. And we're seeing that show up right now really devastatingly in children who are presenting more to emergency rooms with thoughts of hurting themselves or attempts to hurt themselves, and with adults who are having higher rates of addiction and overdose. So it's really important that we acknowledge the toll the pandemic has taken on our mental health. And when it comes to the vaccines, I think people also have sometimes felt triggered about what has happened regarding COVID in this last year when they have to think about going in to get a vaccine. Sometimes it's easier to close your eyes and close your ears and just pretend everything is back to normal than to actually face that we need to do additional things to keep ourselves safe. So if you're struggling with your mental health, I would encourage you to check in with your faith leader or with your clinical provider or the doctor near you so you can get some help. And for folks who are trying to close their eyes and close their ears, I would say the best way to actually protect yourself going forward so you don't have as much anxiety about the threat of COVID, particularly now that the Delta variant is widely circulating, is to get vaccinated.
Thank you so much, Dr. Boyd. For those of you just joining us, you can press 0 on your phone to ask your own question to any of our guests tonight. Our next question, we're going to go back to Commissioner Johnson. Commissioner, what do you see people, families, and close-knit groups in your community needing most at this time, particularly in these late days of the pandemic?
Well, our community of people, family, and groups need to be educated on vaccine more. There is still a large amount of individuals who haven't been vaccinated. So I think one thing I think the ones that haven't been vaccinated should think more about the elderly people and the family members who are at high risk of being sick. So I think being educated more on vaccination and what it does, I think more of the people, community are scared about what they have heard, people dying, and I think just more education on it. You know, it took me a while to get it. You know, I had to be educated more. I was kind of in the process of being kind of scared of it, hearing what people say, but just getting more education for more people and learning more about what it took and to be around. I knew I wanted to get out in the community and do more, so I decided to go ahead and get vaccinated.
Got it. Thank you so much, Commissioner, for your honesty and being candid, and certainly for joining us tonight in your answer. To our audience again, we're going to ask more of your questions momentarily, so please go ahead and press 0 on your phone to get in line if you have a question. Again, if you would like to schedule your vaccine, you can press 7 to connect with someone who will help get you scheduled for a vaccine. Before we take another audience question, we want to go to Kari just once more with one question. Kari, what do you wish more people knew when it comes to the COVID-19 vaccine?
Yes, thank you. So one of the things I wish that everyone knew, and as Dr. Boyd elaborated on earlier, that the COVID vaccinations are safe and they can be trusted and they are effective against COVID-19. They, over the years, people have seen their friends and family get COVID and experience that the vaccination is effective against it and can prevent you from getting COVID. And in addition, that it is wonderful to keep asking your questions about COVID so that you can feel comfortable and safe getting it. For both those who have gotten the vaccination and for those who haven't, at CORE, we encourage you to find your why, meaning the reason why you want to get the vaccination or the reason you were thinking about getting the vaccination. For some, for me, it was so I could be around my family after seeing my friends, and for others, it's so they can travel or so they can be around high-risk individuals as well. So for those who have received the vaccination, it's important to, encourage and be patient with your friends and family that haven't found their why to get vaccination. And for everyone, it's important to just keep asking the question so you can feel safe and trust the vaccine while getting your questions answered to understand it. Thank you.
Thank you, Kari. Certainly for that answer and for just letting us know a little bit more, particularly about that finding your why. And now we're going to get back to getting into more of some of your audience questions. Again, if you have a question yourself, please press 0 to raise your hand so our knowledgeable guests can provide your answer. We're going to go to Mr. Arthur Brown. Mr. Brown, what question do you have for our guest tonight?
Yes, it really was the question. Again, I do believe it is, but my wife and I both had taken both shots, Moderna. My wife contracted that virus after we had taken those shots. She passed away 2 months ago today from that virus. Now, from what I was understanding, that the shots that we took were supposed to protect us from that virus, and evidently it didn't for my wife. So I'm not understanding what happened with that and why it didn't protect her.
Yeah. First and foremost, Mr. Brown, so very sorry for your loss and condolences to you and your family. We'd like to be able to pose this question to Dr. Boyd. If you could, please shed some light on the question for Mr. Brown.
Thank you, Reggie. Yes, Mr. Brown, I am so sorry to hear about the passing of your wife, and I very much appreciate this question. So what we know is that when you get the Moderna shot, which is actually the vaccine that I got as well, when you get any of the COVID vaccines, it decreases the likelihood that you will get seriously sick with COVID or that you will die with COVID. But it doesn't decrease that likelihood to 0. While the vaccines are incredibly effective, I'm talking some of the most effective vaccines that have ever been developed in the history of vaccines, 99.5% effective against death from COVID, there still is that 0.5% risk, that tiny, tiny risk that you could get COVID and that you could even pass away from COVID. So the other thing that's really important for you to understand, Mr. Brown, and all of our listeners today, is that the way vaccinations work best is not just if you and your wife get vaccinated, but if everybody you encounter is also vaccinated. We want people to be vaccinated so that you protect yourself, and we need the people we work with and our neighbors and our children and our caregivers to also be vaccinated so that we never encounter COVID, so that you're never exposed, so that it doesn't keep circulating in our communities, which means that rare risk of getting COVID if you're exposed goes down to almost zero because there's nobody to expose it to you. And so what we're hoping is that listeners today will be moved by what you've heard today and what you've learned and understand that vaccination will protect not just you, but all of the people we love around us, just like Mrs. Brown. So thank you again for that question, and I'm so sorry for your loss.
Thank you again, Mr. Brown, for your question. Thank you, Dr. Boyd, for your answer. And again, as Dr. Boyd said, just really condolences to you and your family, sir. We want to be able to take one more question from Ms. Marion Bryant. Ms. Bryant, would you please let us know what your question is for the evening?
It's Mr. Bryant.
I'm sorry, my apologies.
Yes. The question that I have, and I know that here in the United States, matter of fact, in the whole world, they worked on medical solution to a lot of diseases. And I just need to know that this has been worked at for years until you come to the solution of a vaccine for this particular disease. And I know there's many diseases out there in the world, and that scientists, medical doctors are working all the time for these situations. And I just wanted to know that have they been working on this for years?
Gotcha. Thank you so much for your question, Mr. Bryant. On the question of has the vaccine been worked on for years, and I guess also why it may have seemed to have developed so quickly, I'll turn that over again to Dr. Boyd.
This is another excellent question, and this vaccine has been worked on for years. The first thing you said was the truth, that here in the United States, we have a science infrastructure that works on medical solutions to problems before those problems even arise. And so the mRNA technology that supports the Pfizer and Moderna vaccines were actually in development for the last 10 years. They existed for a decade, and they were even used in other vaccines for Zika and flu virus in other countries, but not here in the United States because we already have a vaccine against flu and because Zika is not endemic here, which is like a mosquito-borne illness. And so the technology has existed for years. It was sitting on the shelf, and our scientists in this country started working on applying that mRNA technology to the coronavirus in December, before it even peaked here. As soon as coronavirus was reported in Wuhan in China, they started working on seeing if they could get that mRNA technology to work for coronavirus. That was before we even had any lockdowns, before any mask mandates, before we had seen a single U.S. case. That's how our science system works. And in this case, we needed them to be working on it early so that we could have it right now. And so I want to dispel the myth that this process went really quickly, because what was fast was when you became aware that science had been working on it. But in fact, science has been working on this at the NIH, the National Institute of Health, for over 10 years. And so that's why we were able to apply it to the coronavirus, because it wasn't the first time we had used that technology to build a vaccine. It was just the first time we had used that technology to build a vaccine that would be used for coronavirus, because it's a brand new virus that it's novel. It was just, it just happened, in December 2019. Great question.
Yes, thank you so much for that question, and Dr. Boyd for your answer. And thank you all for submitting your questions. We're going to, we want to get in one more poll question before we go into a few more thoughts from our guests. And definitely thank you all so much to our guests who've been so generous with their time and their knowledge and their information. The next poll question for the evening is, did you learn anything new from this evening's conversation? If you would please press 1 on your phone if the answer is yes, and please press 2 on your phone if the answer is no. Again, that question is, did you learn anything new from this evening's conversation? Please press 1 on your phone if your answer is yes, and please press 2 on your phone if your answer is no. We're going to give it just a few more seconds as more people are responding and be able to share the results. So thank you all for responding to this question and engaging with us this evening. We see here that 78% of you all who responded have felt as though you were able to learn more as a result of this conversation. That is something that we're very happy and glad to be able to see, and certainly thank you all really for tuning in to be able to learn more and to gain more information. All right, we're going to jump into a quick lightning round of comments from our special guests. This lightning round is going to be really pretty much just 30 seconds per guest. We'd love to be able to start off with Ms. Kviten, then go to Commissioner Johnson, and then go to Dr. Boyd. Ms. Kviten, if you would give us your real quick 30-minute lightning round, a call to action, if you will.
Yes, thank you very much. So thank you, everyone, for listening in tonight and to ask all your questions. We are glad you were able to learn some from these conversations, and we would just like to say to continue to ask your questions, to learn about the information about COVID, that you do feel safe to get the vaccination and that it is accessible and in the area. And so we encourage you to ask the question, to feel safe about getting it, and to share with others, your process and thinking so that those around you will be encouraged to get it as well. Thank you.
Thank you so much, and thank you for joining us. Commissioner Johnson, may we have your 30-second call to action?
Yes, once again, it was an honor to be a part of this Count Me In town hall call, and I want to thank everyone, and especially Dr. Boyd, in light of those detailed information of COVID vaccine. He was great, and everybody else that was on the panel, I would like to thank you again for inviting me, and I'll be looking forward to seeing you all again, hearing from you all again.
Yes, sir. Thank you so much, Commissioner Johnson, for just all the incredible work that you continue to do in Wilcox County, down in South Georgia, with your organizations. And Dr. Boyd, if we may please have your 30-second call to action.
Yes, thank you again for having me, Reggie, and Fair Count. And thank you, Commissioner Johnson and Ms. Kviten, for being a part of this panel. The last thing I want to share with folks is that we're not in the same pandemic that we were in last year. That the virus that's currently circulating now is actually more infectious. And we all live in states and counties that have gotten rid of the other precautions that protect us, like masking mandates or all the distancing requirements. That means you are more likely to encounter COVID right now. That means when you encounter COVID, you're less likely to be protected because the person that you encounter that probably has it will not be wearing a mask, and you may find yourselves indoors with them. And because of that, the moment to get vaccinated is right now. We know a bunch of people from our communities were waiting to see, but now it's not a safe time to wait anymore. Cases are increasing in 47 out of 50 states, including Georgia. Now is the time to get vaccinated, and if you have more questions, feel free to visit our website, www.betweenusabout.us.org, where you can have some questions answered about the COVID vaccines, both in English and in Spanish. And we also have printouts if that's an easier way for you to read the information. Thank you guys for having me.
Thank you all. This has just been a great conversation, and we hope it's provided insight and perspective we all can use to make informed decisions that are best for our families. If you need to find out where to get a vaccine site, as we've spoken about earlier, please press 7. Please visit countmeinga.org and or text your zip code to 438829. Again, That's text your zip code to 438829.